Good afternoon. I'm Karen Holmes Ward. Welcome to Cityline. Later, a new documentary chronicles the challenges that Black women face when seeking maternal health care. But first, it's been announced that the City of Boston's COVID-19 public health emergency declaration will be lifted as of April 1st. But as the masks come off and the vaccine cards are put away, many are hoping that their good health post-pandemic will be protected and secure. But for others, the impact of the COVID infection lingers. It's estimated that close to 80 million people in the U.S. have been infected by the coronavirus. For some diagnosed with COVID-19, even those that have been vaccinated, symptoms can linger for months. In the medical community, these patients are known as long haulers. The CDC estimates 35% of adults don't recover 2 or 3 weeks after testing positive and may still experience difficulty breathing, nerve pain, or even memory loss. And research shows another 10% of COVID patients endure symptoms beyond 3 to 4 weeks after testing positive. There are many potential symptoms of long COVID, but they're usually similar to the symptoms of the original COVID infection. Common symptoms include fatigue, lack of concentration, loss of appetite, memory loss, sleep and mood disorder, muscle and joint pain, coughing, shortness of breath, loss of taste and smell. Now, a consortium of 6 Boston area hospitals and healthcare systems are coming together for a study on the long-term health impacts of COVID-19. The 3-year study, called the Greater Boston COVID Recovery Cohort, is part of a countrywide initiative announced by the National Institutes of Health. And to more effectively and efficiently treat long COVID patients, Boston Medical Center has built the comprehensive, multidisciplinary Recover Long COVID Clinic. And joining me is Dr. Zai Mourate, the founding director of the Long COVID Clinic and an infectious diseases physician at Boston Medical Center, and Dr. Cassandra Pierre, also an infectious diseases physician at Boston Medical Center. Welcome to you both. Dr. Mourate, first, tell us about the Boston Medical Center Long COVID Clinic.
So as reports of long COVID patients started trickling through, we established a multidisciplinary clinic that comprises of infectious diseases, neurologists, pulmonary physicians, cardiologists, and behavioral health specialists, as well as like ENT, speech therapists, physical therapists, and occupational therapists. The goal was to provide comprehensive care to the patients because no 2 patients are alike, and they present with a spectrum of symptoms which require individualized therapy and which require the patients to be guided through like a multitude of different subspecialties with the goal to improving their clinical outcomes.
Dr. Pierre, can you explain more about some of the health factors that might exist in communities of color that could lead to susceptibility to long COVID?
I think that's a great question. First of all, we know that having COVID obviously is a necessary condition of having long COVID, and Black and Latinx people have been disproportionately affected, we know, by COVID-19 at all stages of infection. So that alone makes us, concerned about our community, our Black community, in terms of risk for COVID. We know that there are other socioeconomic factors. Our ability to get time off from work when we are disproportionately working frontline jobs, our underlying health issues, which might be confused for the long COVID symptoms, things that may not have been addressed. We know that Black community has also taken a larger toll in terms of mental health issues during this pandemic and even beforehand. Many of those pre-existing conditions have been exacerbated by the pandemic and may be confused for when people are actually experiencing long COVID.
Dr. Mourate, I'm going to come back to you. So in your experience, are doctors connecting some of these symptoms that we outlined to long COVID, or is it being misdiagnosed, excuse me?
That is an excellent question. I think that the recognition that some of the symptoms are interconnected and could be part of the syndrome is still not as prevalent as we would like. Some people more than others are more likely to pick up and refer the patient for management of long COVID, but otherwise the patients are being referred and seen by subspecialties for individualized symptoms. So like say somebody has shortness of breath and fatigue, they may go and see a lung doctor for their shortness of breath, but they may not connect that fatigue and shortness of breath after recovery from COVID may be part and parcel of the long COVID syndrome. So certainly more education, both on the patient side as well as the physician side, needs to happen.
Dr. Pierre, you're a member of Mayor Wu's COVID-19 Advisory Committee, and this past week the public health state of emergency was lifted. But I want to ask about the levels of COVID positivity in various neighborhoods in the city of Boston. Are they still high? Can we be totally safe?
That is a really important question that you've just asked, because what many of us are concerned about is that as we de-escalate our policies and practices, they may make sense in some areas, but not in others. Although our COVID positivity is coming down throughout the state and within Boston, we have seen longer periods of high levels of infection in some of our communities, the communities that we serve here and that we live in, Mattapan, Roxbury, Rosendale, Hyde Park, Dorchester. Those are the areas that we continue to see, even though the numbers are declining, they're not declining as quickly as they are for the rest of the city or for the state. And we know those are also areas where people are under-vaccinated. So it is important to be cautious and to be aware of where you live in terms of what you're thinking about in terms of protection.
So you're recommending, perhaps, Dr. Pierre, that those communities continue to wear masks in some places, continue to do regular testing?
I think that, I think that certainly in areas where there are high levels of transmission, I think people may also want to get guidance from their own personal trusted medical advisor. But I certainly think that in certain indoor areas, and especially in schools, masks are still necessary. People living with those who are not vaccinated, who are not yet eligible to be vaccinated, i.e. children who are under the age of 5, or living with people who are immunocompromised need to take specific concern and care. I do find that these are communities, including the one I live in, where people are not naturally more cautious because they understand that we are at higher risk.
Dr. Marte, I'm going to close out with you. How are you and your colleagues at Boston Medical Center making sure that communities of color are represented in some of these long COVID studies?
So we are partnering with our community collaborators and community outreach workers to increase awareness amongst our patient population. And we are also doing like physician targeted education to increase that awareness amongst the medical community. We are also developing easy to understand patient education materials that can be distributed, and at the same time will enable patients to understand they really shouldn't wait to seek help and care that they so rightfully deserve.
All right, Dr. Marte and Dr. Pierre, thank you both for joining us. Up next, a closer look at the challenges of Black motherhood from conception to postpartum. The stories of 4 women and how they navigated the reproductive health care system.